Welcome back to Rural Health News, the segment of Rural Health Today, where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what's most urgent? The FBI, Cybersecurity and Infrastructure Security Agency, and other international agencies issued a joint advisory on August 10th advising hospitals to be on guard against the ransomware service group Gunra. The group is actively targeting healthcare organizations, gaining access by exploiting weaknesses in authentication bypass processes. When they make it into the system, Gunra encrypts and ransoms data under the threat of leaking stolen files. Current cybersecurity recommendations for hospitals can be found at cisa.gov. Now on to the damage report. The Centers for Medicare and Medicaid Services finalized their new payment rule for hospital and patient prospective payment systems and long-term care hospital prospective payment systems. The rule updates payment policies and rates for Medicare patients, including changes in codifications for organ acquisition, reimbursement appeals, and tissue-compatible lab testing. These annual updates from CMS help determine how acute care hospitals, teaching hospitals, and PPS hospitals operate based on capital-related cost. There are several key elements of the new rule. Hospitals participating in the Inpatient Quality Reporting Program will receive a 2.3% payment increase, totaling nearly $2 billion in payment growth. Spinal fusion's eligibility is expanded to align attribution and quality measures with other CMS programs. Disproportionate share hospitals will now face decreased payments for uncompensated care, approximately 3.3% or $7.46 billion in payment decreases. The low-wage index policy is discontinued through this rule, and in its place, CMS will implement a budget-neutral transition while maintaining other wage index adjustments. The new rule will go into effect October 1st, 2026. And now for today's success story. Recruiting doctors to work in rural healthcare can be extremely challenging, especially when providers who grew up in a city would rather live and work in one too. Rather than focusing on students from urban communities, the Edward Via College of Osteopathic Medicine in Blacksburg, Virginia, has spent the last 20 years training the next generation of rural doctors by enrolling local, small-town students. Medical students in the program are exposed to unique rural healthcare challenges in the classroom and by staffing free healthcare clinics as well. As a result of their efforts, doctors graduating from Edward Via College are more likely to practice rural medicine long-term compared to doctors incentivized to work in rural health through short-term federal programs. I love stories like these because they show how supporting local talent provides a years-long solution to staffing challenges in our rural hospitals. Thank you to our sources for this episode: the Cybersecurity and Infrastructure Security Agency, Becker's Hospital Review, the Centers for Medicare and Medicaid Services, Holland & Knight, Applied Policy, and WDBJ.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.